clarify. I would like to clarify that I am not a doctor. I am a clinical psychologist. Okay. I've completed my master's in clinical psychology. So doctor is the next step ahead. All right. So it's a pleasure having all of you online today to be a part of this session. And I'm happy that there are so many people who would like to give importance or prioritize their mental health. So without wasting much of your time, I just want to ask a few questions before we start the session. Um, how many of you over here, like online now, or probably in the past 6 months or past 1 year have felt, low moods, pretty swinging, and feeling upset, irritated, angry, or sometimes restless also? So feel free to raise your hands. So I'm one of them too. So all of us, I think most of us have experienced this, right? If I'm not mistaken. And today it is more to do with not just feeling, it is also trying to understand what these feelings are all about. All right. So to start with, I'm going to start sharing some, see, to understand depression, we need to, to actually first overcome depression, we need to understand what depression is. All right. So I'm not going to be wasting too much of time on what depression is tomorrow, just today, just briefly psycho educating you all about the illness, and then we will go on to the techniques or skills on how we are going to be overcoming depression. All right. So all of you can lower your hands now. So we call it beating the blues. It's like the Monday morning blues. Similarly, all of us have so many, days where we feel really low, very moody, don't feel like going to work. Like, chalo, aaj pade raho, bas, I don't feel like getting up from the bed. So it is just one symptom. So we will be covering multiple symptoms of depression. And then we will be arriving at a conclusion whether or not it is depression. All right. So let's start with it. So there is hope even when your brain thinks or tells you there isn't. So remember this always, that even if your brain is saying something, you can actually fight against it. All right. So there is always hope. So never lose hope. So the objectives of today's session is going to be understanding depression, just briefing you through it, causes, signs and symptoms. How do we diagnose it? Then what is the cycle of depression, which is very, very important for one to understand if you want to overcome it. All right. Then some self-help techniques we'll be talking about. One very important aspect I'm going to be discussing is the challenging of negative thoughts, which helps a lot in depression. Then how do you help your loved ones? It's not only you. Sometimes you see that your significant others or someone close to you, a friend, a family, a relative, from the family, is suffering from depression. How do you identify and how do you help these people? Then also we will be talking about the post-pandemic twist, which has made a lot of difference, in our mental health, all of us. And how are we going to change our focus in our day-to-day life and activities? All right. So to understand depression, we have to understand it through people who have kind of, done a lot of research. And one of the bodies which has done a lot of research on mental health is WHO, World Health Organization. So it is a common mental health disorder, and it is one of the main causes of disability worldwide. So don't feel alone. Don't feel that you're the only one. There are a lot of us sailing in the same boat at times. So it's not only you. There are many people, who are suffering from the same problem. So 264 million people affected. This is, I think, 2019 or 20 ka statistics. I have not yet received the updated one as of now. More women are affected than men. But there is another statistic which will come later, and it can happen to anybody. It is not a sign of weakness. Please remember this. All right. And it is treatable. It's a mood disorder. It involves a persistent feeling of sadness and loss of interest. So if you're feeling sad just, for a couple of days in a week, doesn't mean that you're suffering from depression. All right. It has to be a persistent feeling of sadness and either a loss or a lack of interest and enthusiasm. It is different from mood fluctuations. Please, make a note of this. Mood fluctuation is totally different. It is related to mood disorder. It affects your day-to-day functioning. All right. Anytime you have a feeling of, persistent feeling of sadness, lack of interest, lack of enthusiasm, and it is making you dysfunctional in your day-to-day life, that's when you need to, it's like should be the warning bell for you. It is an ongoing problem and not a passing one. Again, I just told you that it has to be, talk to you about the specific time period. It has to be at least for over a period of 6 months minimum. All right. So remember this here. The episode should last for at least 2 weeks. Okay, up to several years. Episodes means we are talking about severe episodes. All right. Persistently you're feeling sad. Persistently you're feeling, low, lack of interest. So 2 weeks also, I feel you can extend it to 3 weeks, because nowadays things have become so, I would say negative, that it is difficult to understand even in 2 weeks. I would suggest that you wait for at least 3 weeks before you start taking some steps about it. Okay, some of the signs and symptoms are that there is trouble concentrating, remembering details, and making decisions. Another is a feeling of guilt, worthlessness, and helplessness. Now, this is actually a very, very important part and aspect of depression, where you feel a lot of guilt about something which has either happened in the past, or what is something which is happening currently. So normally guilt is, depression is related to a lot of things which has happened. It is negative things, negative thoughts connected to your past. So this gives you a sense of guilt, sense of worthlessness. There's a lot of self-downing. Hence, there is a feeling of helplessness. Again, pessimism and hopelessness. So thinking positively becomes very difficult. See, many times people, whenever you go and talk to somebody and say, I'm feeling really low today. What do they normally tell you? It's okay, just chill, kind of take it easy. But it is very difficult for a person who's suffering from depression to be optimistic or positive. That is why we never tell, whenever anyone comes with depression to the clinic or to the hospital, we don't ask them to start thinking positively. We ask them to challenge their negative thoughts, which is what we will be talking about later. All right. So insomnia, early morning wakefulness, sometimes sleep is a big problem. All right. Either you sleep too less or you sleep too much. All right. Crankiness or irritability. Now, this is a symptom not only in adults but also in children, which you have to look out for. Nowadays, post-COVID, children are also have started suffering from depression and anxiety. Restlessness and a loss of interest in things that we used to find pleasurable earlier, which includes also sex. Overeating or appetite loss. So there is either significant weight loss or weight gain. Aches, pains, headaches, or cramps that won't go away. There are times when many times we have had cases like I still remember a case where this girl, I think a 13-year-old girl came, and she was complaining of a stomach ache, and continuous vomiting. Whatever I eat, I cannot digest. And she went through all the physical, the physiological tests. Everything was ruled out. And finally, they sent the child to me that this is a psychosomatic disorder. There is something connected to her thought process which is not allowing, or something related to emotions which is causing her aches and pains. So many times over a period of time we suppress a lot of emotions, that creates a lot of negativity in the body, and it comes out in the forms of aches, pains, headaches. Ideally it actually attacks either your joints or your digestive system. So please be careful about these two things. If you have something which has been troubling you for a long time, which has no other explanation, then please get yourself evaluated. So again, digestive problems that don't get better even with treatment. Persistent, sad, anxious, or empty feelings. All right. I'm not explaining in detail all this because we will be targeting the other aspect more. Suicidal thoughts or suicide attempts. So either you should be having ideations of suicide, or you may have attempted or tried to take your life a couple of times. There is also, I have seen a lot of patients nowadays. In fact, I am seeing a lot of patients who come with self-hurt, self-harm, problems. That is also one of the symptom of depression. So they lose pleasure in life. All right. Essentially, they lose pleasure in any kind of activity. Now, as I was talking to you about children and adolescents, this has also been coming since I'm connected to a school. This is something which, I see very regularly. Even in the hospital, I get 10-year-olds, 12-year-olds, 15-year-olds coming with, problems of anxiety and depression. So other than the normal problems that we discussed, these people have something known as, these children or adolescents who would be suffering from depression may have something known as anhedonia, which is known as inability to feel pleasure in normally pleasurable activities. Negative self-esteem. There is a belief that I can't get anything done or I am not good at anything. This has become very common I see in adolescents more, in the age group of say 12, 13 plus. Ineffectiveness, that is lack of motivation or inability to complete tasks. Whatever task you give them, they are not able to focus and complete that particular activity, whether they are in a group or whether they are individual. Interpersonal problems, there's a lot of social withdrawal. Children have learned to lock themselves up, isolate themselves from even family members. So they have difficulty making and keeping close relationships. Another major cause, I think we'll come to the causes later. And negative mood, that is irritability or anger. So these, other than all the other symptoms that we just saw, these could be added to the for adolescents. Now, how can parents, now this I've just added this actually because I felt it is a need of the hour. Some of you may be parents, or some of you could be uncles, aunts. You can probably help your young ones. Parents, it is very challenging for them to how to recognize. Many of them come and ask, ma'am, how do we do this? How do I understand that whether my child is suffering from depression or no? So it's very difficult, it's not very easy. So it is better to take professional help. So they always come and say that it is hard to tell the normal ups and downs from depression, because children's mood keep fluctuating so much. It is very difficult for us to identify if it is genuinely depression or something else. And youth are very good at hiding feelings. They may share very openly with their friends, but in front of their parents, they are like zip tight. So we don't talk much about feelings, like as a parent child, I don't discuss much about how I feel, or I don't ask my child how he or she feels. Or even if we discuss, the child is not comfortable sharing their feelings. Parents don't have much time to spend with the youth. That is another important aspect. And they are not sure what signs of depression are. So we will be taken up at a later stage. In fact, I'm planning something for specifically for children and adolescents, which will be done at a later stage. We can talk about that in detail later. This is just, I'm just giving a brief overview right now. So what could be the causes of depression? Can anybody, there are so many participants. I would like somebody to, if anyone knows or anybody is aware, what could be the cause? One of the cause, anyone would like to volunteer? You can raise your hands. Yes? Okay, I'm getting answer of lack of communication, anxiety, child abuse, trauma. Yes, very good. All right. Okay. Santa Vigraha Prabhu can probably answer. Yes, low vitamin D levels. Very good. Excellent. Santa Vigraha Prabhu, can you please unmute and answer?
Hare Krishna.
Hare Krishna
Maybe
Maharaj.
loss of loved ones or problems in relationships.
Yes, definitely. So these are socio-environmental problems that are a part of one of the causes of depression. So I'll just move on. So several factors play a role in its onset, including genetics. Now this is something which many of us are not aware of, but genetics does play an important role in transferring, I could say, depression from the parent to child. Not There is not much research which shows that it is 100% research available nahi hai, but still there is a lot of connection because we have come across many cases. In fact, I have personally come across many cases in my last 7 to 10 years of experience where the child is suffering from depression, and definitely there is a family member, need not be a parent, it could be one of the relatives. So abuse could be any kind of abuse: physical, sexual, emotional, any abuse, even substance and non-substance abuse. Okay, which is the next one. Suppose somebody has been on drugs, or somebody has been taking some medications for quite some time, which there are some medications which cause um, depression. All right. So non-substance abuse is what we call this, the Ravan of today's age. All right. So mobile is a non gadget addiction is a non-substance abuse. So that also there has been significant research done already in the COVID period, and a lot of children today and adults are suffering from anxiety and depression because of excessive use of mobile. All right. That comes under non-substance abuse. So it could be due to some hormonal changes in the body, which could be either menarche, postpartum, or menopause. Or it could be some thyroid related issues also, which causes hormonal changes in the body. Personality traits: people are born with certain traits. Now how do we know these, that I have these kind of traits which could probably lead to depression? Now there are certain psychometric tests which are available, which are very reliable, which actually accurately is able to describe what kind of a personality trait you have. Suppose for example, I can give you something like, if you are a negative, there are certain um, significant markers which you can say is like, there is something known as a negativistic personality, a person who can only be pessimistic in whatever he or she thinks. Even if something good is going to happen, he will anticipate the worst. All right. So if people who have this kind of a personality pattern or trait, which has either acquired over a period of time or has been passed on as a personality trait from the through genetics, such kind of people have a tendency to suffer from depression more than others. Other illnesses also cause depression, like cancer, diabetes, Parkinson's, or any terminally ill disease, which can probably create a lot of depression in a person, because he or she has been battling with it for such a long time that they don't know how to deal with it anymore. Any life changing events like the death of a near and dear one, or like they just shared, somebody has, separation, family divorce in the family, parents are getting separated, or they've lost someone in the family, or there are major arguments happening in the family. So there are many things which can in and around our social life or around our life that can change and bring about depression or cause depression in our or make us suffer from depression. So, what is the this of diagnosis? Physical examination is normally done. The first step is, you go for a physical exam to rule out any physiological conditions. Like this girl who had come to me, first the doctor will ask her to go through the complete set of physiological, tests like a blood test, X-ray, CT scan, neurological screening. All the screening gets done, and finally, if they find out nothing is connecting to the particular illness, then they send the person for the next step would be uh, any kind of hormonal imbalance in the body. All right, that also any deficiency, like somebody said, vitamin D deficiency. So blood work is done to check certain hormone levels and certain deficiencies in the body. When everything is ruled out, finally the person is sent for a psychometric evaluation. Now this evaluation is to check your mental health basically, and it's a reliable objective and subjective tests are available in the market today. So there is no fear, that the results that come out are going to be bogus or fake, nothing of that kind. These are 100% accurate results. So now this is the cycle of depression. All right, it starts with your thoughts. Now, normally what happens, okay, I'll just first explain. So there's something known as the, cognitive triad. When we have something known as the cognitive triad, where it's a triangular thing, it starts with your thoughts, it comes to your feelings, and finally it connects to your behavior. But actually, all these three are interconnected. All right, I'll explain to you how. So the thinking starts from I'm useless, I feel hopeless, it's all my fault, I'm not attractive, no one likes me, I don't fit in, nothing good happens to me. So there are many other things, I'm responsible for whatever bad happens in the family. I should have not been born, there is no point in my existence. So these are the thoughts that keep troubling a person with some of the thoughts. It could be there are hundreds of thoughts that keep coming to us every day. Now, these are also known as automatic thoughts. So we don't have control over these thoughts. All right. So we have to understand that these thoughts cannot be controlled, but they can be managed. All right. So after thinking comes the feeling which is connected to a thought. Now, suppose I feel that I'm useless. Okay. What do you feel? When I say I'm useless, I feel hopeless. What is the feeling that is connected to this thought? It would be feelings of feeling low, feeling guilty sometimes feeling hopeless, sometimes angry. All right. So there is always a negative thought or negative feeling connected to a negative thought. What is the body? The physical sensation in the body. All these thoughts and feelings will trigger a response in the body. Okay. Always there is a physiological response to your thinking and your feeling pattern. So the sleep becomes poor, appetite. So either you eat more or you eat less. So something known as emotional eating, which many of us have developed during the COVID period. So there is a tendency to move to comfort food, junk food. And it's very difficult to break that habit. All right. So there's lack of energy, headaches, concentration is very poor. You're not able to remember things. So these are some of the physical reactions or responses to a particular thought or feeling. What do you do after you finish thinking and feeling such things and the physical sensations are there? What are the activities that you normally do? You will stop doing your usual. What is the point? What is the point in me going to work? What is the point in going to school? What is the point in getting up and doing all this work? People don't appreciate me in any which ways. So even if I make breakfast, they are not appreciative. Even if I don't make breakfast also, they are not appreciative. So what is the point in doing? So let me not do this work. So there is a withdrawal from doing the activities and also from people. I don't want to talk to these people. They don't appreciate me. Right? Then there is also a tendency to stop taking care of oneself. So self-care is the last thing, is the last in the list of priorities. Waking up, brushing your teeth, taking a bath, being clean, taking care of your hygiene, that comes last. And to substitute that, you start spending more on yourself. Probably you buy things for yourself. So this is one of the things that you do. So there's something known as the shopaholics. So these people, whenever they feel depressed, they go and binge spend. They spend a lot of money and they come back home and they feel emotionally satisfied at that point in time. Some people take to drugs, some people take to alcohol, some people smoke. So it could be anything, any activity which makes or gives you pleasure. All right. So these behaviors make us feel more hopeless and affect our self-esteem, causing the depression to continue. So at that point in time, when you do this activity, temporarily you will feel good. But again, what happens? Again, you will start feeling low. So the cycle does not stop. You're not taking care of a very important aspect, which we will be coming to later. So here what we're doing is how we behave reinforces thoughts and feelings. So the cycle continues. The cycle does not stop here. All right. So we will be talking about how we are going to be stopping the cycle later. So coping skills, one of the coping skills. Yes. You have any questions? Okay. Acha, people are asking in Hindi. Okay, I will have to make it Hindi and English because there are some international people also. So I don't know whether all of them understand Hindi. So if you don't understand anything, please raise your hands and ask. That would be better. अगर आपको कुछ समझ में नहीं आ रहा है तो आप प्लीज पूछिए मुझे. All right. So coping skills means इससे हम कैसे जूझे? How are we going to deal with this? All right. So self-help is the first part is sleep routine. Every day you should have a fixed time to go to bed and fixed time to wake up in the morning. कोई भी distraction नहीं रहना चाहिए. There should be no distractions anywhere in and around your bedroom. That distraction means TV, mobile, जो हम लोग normally, which we normally have at night before we go to sleep. So all these things should be kept in the hall before we go to sleep. All right. Especially people who are trying to deal with depression, इनके लिए बहुत important है कि वो avoid करें. All right. I'll be taking questions later. Okay. So let me finish with the presentation. All your questions will be asked, answered. Don't worry about it. So diet routine, again, there are three things which are very important: sleep, exercise, and diet. Sleep sufficient रहना चाहिए, exercise proper रहना चाहिए, physical activity, और खाना ठीक से खाना चाहिए. So avoid. So when you have a diet routine, when you eat every day regularly at regular times, emotional eating जो होता है, binge eating, can be avoided. All right. Like sometimes suddenly you feel like eating a pizza or a burger, or you feel you can sweet cravings होते हैं, तो ये सारी चीजें you can avoid. All right. So both help in building structure and lifestyle, sleep as well as diet. Third is exercise. So exercise करने से क्या होता है? Generates happy hormones in your body, which are known as endorphins. So this is a long term strategy. Okay, इसमें आपको short term में कुछ benefit, immediate benefit मिलेगा, but in the long term it is going to help in a depression like anything. Just get up and push yourself to go for a walk every day and see what an amazing difference it makes in your lifestyle. Take responsibilities, छोटे छोटे baby steps, small responsibilities. पहले छोटा सा responsibility ले लो, like, you just tell that, okay, from today onwards, I will take charge of, cleaning the plates, or I will take charge of clearing the table after dinner. So these are small things, small goals, छोटे छोटे goals set कीजिए. And once we set small goals and we achieve those goals, जो छोटे goals है उसको हम achieve करते हैं, तो एक sense of accomplishment आता है कि हाँ, आज मैंने ये किया. So that gives a boost to your confidence and you feel better. Challenging negative thoughts begins with denial and then moves on to acceptance. So I am going to come to this later because that is something specifically I'm going to be talking about. तो कुछ नया नया ट्राई कीजिए, try new things, when we are suppose we are in the on a highway and we are driving for a long time, what happens? You tend to become a little complacent, ना थोड़ा आराम कर लेते हैं. You put them on the cruise control. गाड़ी cruise control में डाल देते हैं हम लोग. But here we can't put the vehicle on cruise control. Here we have to change the gear. Okay, so gear has to be changed because the brain needs to be rewired. Brain एक तरीके से सोचने पे मजबूर किया जाता है over a period of time that I am hopeless, I am worthless, I can't do this, I can't do that. तो वो thought process को change करना जरूरी है. तो उसके लिए unless and until हम लोग gear change नहीं करते, तब तक वो brain chemicals में alteration नहीं लाएगा. So when you try new things, what happens is कुछ नई चीज हम लोग ट्राई करते हैं तो it alters the brain chemicals. So dopamine level जो रहता है brain में, which is connected with pleasure, okay, learning and enjoyment, वो हम उस केमिकल पे काम करते हैं, डोपामिन लेवल पे. तो अगर हम कुछ नया चीज ट्राई करते हैं तो वो डोपामिन लेवल चेंज होता है, ऑटोमेटिकली ब्रेन का थोड़ा सा रीवायरिंग रीस्ट्रक्चरिंग होता है एंड थोड़ी सी प्लेजर और एंजॉयमेंट मिलती है हमको न्यू चीज ट्राई करने से. ऑलराइट, हैंग ऑन टाइट, डोंट गिव अप, यू आर ऑन द राइट ट्रैक. अगर ये सारी चीजें आप फॉलो कर रहे हैं, यू आर ऑन द राइट ट्रैक, डोंट गिव अप, कंटिन्यू डूइंग दैट. फैमिली बॉन्ड स्ट्रेंथन कीजिए, टाइटन कीजिए अपना फैमिली के साथ में जो भी बॉन्ड्स है. टॉक टू योर पेरेंट्स, टॉक टू योर सिबलिंग्स, टॉक टू योर फ्रेंड्स, टॉक टू योर रिलेटिव्स, whoever you are close to, strengthen the ties and strengthen the bonds with them. Again, volunteering is a wonderful way of achieving satisfaction. अगर आपको एनिमल्स में इंटरेस्ट है तो आप पेट्स के लिए कुछ कीजिए, सोसाइटी में कुछ कीजिए, अपने बच्चों के लिए या बूढ़ों के लिए. गो टू एन ओल्ड एज होम, गो टू एन ऑर्फनेज, कुछ भी कर सकता है वॉलंटियरिंग वर्क के लिए. So there is no limit for volunteering work. I'm sure there are many NGOs which require volunteers. कुछ नहीं तो you can plant a tree. That is also something to do with nature. That's another thing which actually I think I've forgotten to mention is connecting with nature. It's very important. That's why when you're going for an exercise or you're trying to do some exercise, yoga or walking helps a lot. Going out and connecting with nature helps a lot, because that really helps bring down. When you're in touch with nature, it makes you calmer, it makes you more human, it makes you more receptive to things, and you see things with a new perspective. All right, so talk to friends, relatives and family members. When should you seek professional help, and what are the professional help that is required? When should you seek? We have seen the symptoms 2 weeks, 3 weeks and above, then you need to go in for professional help. Therapy is very, very useful in depression. All right, medication, if we need it, if necessary, medication should be taken, must be taken. Please do not hesitate to take medications, because there is this a tendency to neglect मेंटल हेल्थ और साइकाइट्रिक मेडिकेशंस. ऐसा कुछ नहीं है कि एक बार आपने शुरू किया वो जिंदगी भर कंटिन्यू होगा. नथिंग ऑफ दैट काइंड. ओके, देयर आर कोर्सेज व्हिच एंड इन 3 months, 6 months, 1 year, depending on the intensity and gravity of your illness. So let the doctor decide how long you should be on medication. Sometimes even supplements help you. You may not be suffering from too much, it may be a very mild kind of depression, so some kind of supplements also can be taken instead of allopathic medications, but that also has to be done in guidance with your doctor. अपने आप कोई medication मत लीजिएगा. Please take guidance of a proper doctor, professional, और उसके बाद में जो करना है वो कीजिए. Okay, acceptance helps. Now क्या होता है acceptance means? पहले first thing क्या है? Normal clarity and happy, humorous, optimistic existence रहता है. Oh, what a beautiful morning, what a beautiful day, इतना अच्छा दिन है, मुझे इतना अच्छा फीलिंग हो रहा है अभी. Everything has 50% chance of going my way. मतलब आज का दिन अच्छा जाने वाला है. फिर suddenly you get a bad news, कि ऑफिस से कॉल आ जाता है that you have not got the promotion that you're looking at, or the deal that you were trying to crack, जो आप जिस डील पे आप काम करने वाले थे वो ठीक से नहीं हुआ, या उसमें कुछ ऑब्स्टिकल्स आ गए, कुछ चैलेंजेस आ गए, और फिर आपको सडनली क्या लगता है? डिनायल. दिस कांट बी ट्रू, इट कांट बी हैपनिंग टू मी, इट्स ऑल अ पैक ऑफ लाइज. एंड डिनायल के बाद नेक्स्ट इमोशन क्या है? एंगर. हाउ कैन दिस हैपन टू मी? Aggression. Get out of here, get lost, don't talk to me, don't tell me anything about this. And sometimes you also become physically violent due to anger and aggression. After that, the cycle goes on to depression. Oh, this cannot be true. There is nothing I can do about this. Now, abhi ye deal nahi hua to mere life mein kuch bhi nahi aage. There is nothing left for me. I lose my job. My boss is going to kick me out of this job. So there are many thoughts that can come at that point in time. So it's usually hopeless. So there is a lot of confusion. So what you normally do is that in such cases, we try, and if you are a little, you're able to think normally at that time, what you would do is you would move into from denial to a little bit of bargaining mode. कि ठीक है, ये क्यों हुआ? Why did this happen to me? I didn't do anything wrong for this to happen. Let me look at the picture. Okay, so I did this 1 2 3 4 ये सब मैंने किया, फिर भी ये सब हुआ. ठीक है, I mean things are a little bad, but they're not so bad. Let me just work on certain things, and maybe I'll come out with more solutions to the problem. So we come to an acceptance level. Okay, things, it could have gotten worse. Probably, I could have lost the deal, but now I can still save it. So you come back to at least optimistic existence if you're able to correct yourself at the right time rather than going deeper into the negative thinking pattern. So this is a cycle. The first step, denial, and then acceptance of the problem. All right. Next is, what are the different types of negative thoughts which you're talking about? I feel I am up against the world. I'm no good. Why can't I ever succeed? No one understands me. I have let people down. My life's not going the way I want it to. I'm so disappointed in myself. Nothing feels good anymore. I can't stand this anymore, and I can't get started. So these are just some of the negative thoughts. There are hundreds that keep coming to us. Now, how are we going to challenge these negative thoughts? अभी हम लोग ने एक cycle देखा था. First cycle we saw was for the cycle of depression, right? The next cycle we saw the cycle of acceptance. Now we are going to see the cycle of challenging your negative thoughts. Okay, now what are negative thoughts? Negative thoughts could be, these are the thoughts that come automatically to us. They are known as NATs, negative automatic thoughts. All right. शॉर्ट फॉर्म में नैट्स बोलते हैं उसको. तो when these thoughts come, what are we supposed to do? I'll tell you the first step. Okay, first you have to identify those automatic negative thoughts. तो आपको लिखना पड़ेगा. You will have to make a note of all the thoughts that are coming to you. Then you ask this question, is this thought helpful? See, at that point in time, you will not be able to do this. Let me tell you this very clearly. When the thoughts come, at that point in time, you will not be able to work on it. But when you are in a calmer state, when you are in a better state, please write down all those thoughts that you had. And then you ask this question, is this thought helpful? Okay. Is there another way? If it is not helpful, is there any other way of looking at this? Okay, जैसे अगर हमने let's take an example of I would say, okay, like let's talk about the deal only. That okay, my deal, I have not been able to crack this deal. I'm no good. I've always been somebody who has not been able to be, so I'm not successful. I'm not a good businessman, or I don't have a good business acumen. I can't crack deals. So ये सारे thoughts आने लगते हैं हमारे दिमाग में. फिर हमको पूछना है कि how is this thought helping me? Is this thought helpful? No. Obviously, this thought is not helpful. So is there another way of looking at this? What is the another way, an alternative way of looking at the situation? Like suppose I say, okay, fine, like the cycle of acceptance that we saw earlier. The other way was bargaining. Okay, I mean, this time I did not crack the deal, but probably next time I'll work on those other aspects and see whether it works out. All right. And what evidence is there now? What evidence is there now? You've been working for many years, correct? आप बहुत साल से काम कर रहे हैं, आपने बहुत सारे डील्स क्रैक किए अपने लाइफ टाइम में, राइट? ये एक डील क्रैक नहीं किया, so does that make you a bad business person, or does that make you a bad sales person or marketing person or manager? So you have to look for evidence always. कि मेरे इतने सालों में, you know, for example, like suppose my daughter, or I have a daughter who's over 23 years old. So suppose my daughter commits something, some grave mistake, you know, and suddenly I feel, oh, I'm not a good mother, you know. But is this thought helpful for me as a mother? You have to think that way. कि ये क्या ये चीज मुझे help करेगा? Is there another way of looking at it? Okay, this time she has done this mistake and she's now 23. So she's responsible for her behavior. I'm no longer responsible for what my daughter does, right? Because she's an adult now. So she has to learn to take responsibility for her behavior. And what is the evidence? I have brought her up for the last 23 years. How many instances like this have happened that, you know, okay, I have not been a good mother to her? Very few. So that does not make me a bad mother, right? So I have to stop labeling myself that I'm a bad mother, I'm a bad marketing manager, I am a bad business person. So ये सारे labels हम लोग अपने आप को लगा लेते हैं, and that is what actually pulls us down. So how would someone else, how would you advise somebody else about this particular situation? We would say, अरे it's okay ना, ये बार exception हो गया. Last time it was not so, you know. How many times has something like this happened in your life? So it's okay. It's all right. Take it in your stride and move on in life. And what advice would I give someone else? Same thing, right? So is this a fact or an opinion? The fact remains that yes, my daughter has made a mistake, right? But at the end of the day, I am not responsible for everything that she does. She is an adult right now, correct? So I have whatever had to use for cracking the deal, I have done. I have taken all these steps required. So that is the fact. I had to do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. These are the things that I had to do, and I did that. मैंने किया ये सारी चीजें. ओके इसके बावजूद अगर डील क्रैक नहीं हुआ तो ये मेरी गलती नहीं है. इट इज नॉट माई फॉल्ट because there are so many factors which are not in your control, right? You have to get approval, sanctions, bahut kuch hai, finances, many things are there. So it may crack, it may not crack for many reasons. So you have to be aware of that. So if this is a fact or it is an opinion, so there are certain things which are facts in your life, certain things will always remain assumptions, which is coming out of your overthinking. कि ऐसा हो सकता है, ऐसा किया था, ऐसा, you know, these are the things which will come as opinions. Okay, so don't believe what you think of as opinion. Go on the facts always. Okay, at the present, what is the fact? That I am a mother, she is my daughter, she has made a mistake, and I am not responsible for this particular mistake of hers. So this is the fact. Okay, an opinion could be क्या कि अरे you know लास्ट टाइम भी उसने ऐसा कुछ किया था, आगे भी वो शायद वैसे ही करने वाली है. सो दिस रियली में दिस मीन्स दैट मैं एक अच्छी माँ नहीं बन पाई. सो दैट इज एन ओपिनियन, इट इज नॉट अ फैक्ट. So you come up with more realistic, last option is you come up with more realistic and optimistic thought. Okay, so what if she has made a mistake? You know, I can still work on her to make her more responsible. I can still work on this deal and try and crack this. I can still work on the other factors which are coming to, you know, which are leading to not cracking the deal. So these are the ways and means in which we can actually come up with realistic and optimistic thoughts. Okay. See, I'm not talking about positive thinking only here. I'm also talking about realistic thinking. So please, this word realistic and fact is very important here. All right. So I hope this cycle is clear. If anybody has any questions, you can ask me later about it. So how do we help a loved one? Now, this is something which is very, very important because sometimes we see a family member suffering from depression or anxiety or any mental health problem. So how do we help? Because our support is going to help this person come out of that particular illness. So first thing you can do is listen to them. very nicely, very calmly, be supportive and calm, listen to them, help them find support. Okay. If you feel you cannot help them, please go to a professional. With them, go with them. If required, take them to a professional, help them find support, and support them in continuing the therapy. That is important. Therapy, medications, counseling, anything, whatever you decide, you want to do. Take care of yourself, because you're taking care of a mentally, you know, um, unstable or emotionally, I don't want to use the word mentally, emotionally, labile or moody person. You have to take care of yourself, because you have to set very clear boundaries that beyond this, I am not going to, work on this, because it is going to start affecting you otherwise. It's like, when you're, when somebody is drowning, we normally give this example in our classes. When somebody is drowning, how do you help the person? If you don't know how to swim, obviously you will not jump in, because you will drown with that person, along with that person. But if you don't know to swim, you can always reach out and give a rope to that person, right? And you can pull that person out. Now, it is up to that person whether he or she wants to take that rope. Similarly, here, you can give them that support till the time it is, till the time they want that support. When you feel that they don't want that support, or they're not willing to take that support, you have to take one step behind, because then it starts affecting your health. Setting boundaries is all about that. You need to know about depression first. So this is what you should be aware of. You should know what depression is, how to identify signs and symptoms of depression. All right. Help them achieve their goals. Like we said now, that one of the ways of self-help is set small goals. So when they, help them achieve, like suppose you're supposed to clear the table, you can probably help them clear the table for a few days, and then after that, that person will be able to do it on his or her own. So when, and after they achieve their goals, appreciate them. Wow, you've done a great job today, so that gives them a boost. Offer to help with everyday tasks, like suppose they have to go to work, or if they have to do something on their own, like suppose husband and wife are there, and wife is suffering, this one of the spouses is suffering, especially if the wife is suffering from depression, it becomes very difficult, because day to day work also becomes a major problem, getting the breakfast done, or getting, you know, things ready for breakfast, even getting things ready for dinner. So probably the spouse can, reach out and help. "Okay, can I help you? I can get up and help you in making breakfast." So when the activity is done together, the person feels that there is a supportive environment and will want to, do that. So extend loose invitations. Keep telling them that I'm there, I'm available for you, even when you know that they may not accept those invitations. And most important is being patient with such people. So post pandemic twist is the anxiety depression cycle has set in. People who have anxiety have depression, and if people suffering from depression have anxiety. So it's a combination. They are like, they complement each other. So if you have depression over a period of time, definitely you will be, having anxiety issues also, and even the other way around, because it is, both are to do with thought, thinking process. So social anxiety, this I'm talking about post, COVID. There's a lot of people suffering from social anxiety, isolation, frustration, feeling cut off from, their roots, economic and job uncertainty, fear of death, self and loved ones. So all these factors also contribute to depression. Troubled relationships. Okay, there have been, I think, post COVID, probably the divorce rates hit a new high. So being together in the same house, seeing the same face, led to a lot of complications. And getting back into routine also became a difficult thing, where, work, getting back to work, or even getting back to the usual routine. I can still see parents struggling in the morning to get their children ready to come to school, send dabba, send lunch box, or, breakfast dabba. So getting back into routine is a major issue for many parents. And also a lot of obsessive negative thoughts have started cropping up in many people. So you have to change your focus. What do we do now? We need to change our focus. You need to distract yourself from your, thoughts or your negativity. Then you have to find very simple sources of joy. Small things that keep you happy, very small things, talking to your spouse, talking to your children, spending time with a close one, loved ones. That is important. Limit your consumption of news because mostly the news is unreliable. Maintain a routine. Again, I am emphasizing on routine, that is sleep, exercise, diet, and here recreation also comes into the picture. Express gratitude. During COVID, I think I sustained only on gratitude, frankly speaking, being grateful for whatever I'm getting. You know, I had complaints. I'm not saying that I did not have complaints. Many people sustained on gratitude actually. Just being grateful for whatever, the 3 meals that you're giving me. Krishna, I'm happy for that. I'm grateful to you for that. So I don't ask for anything else. Because I used to look out and see all the construction workers. There was a lot of construction work going on. And I used to see those laborers just sitting over there with no work, no proper meals. So we used to sometimes sponsor meals for them. So just that particular option that, at least I have 3 meals a day, I have food, shelter, basic food, shelter, and clothing that I'm getting taken care of. So that gratitude also helps in bleak times. Find ways to be connected to friends and family. This helps in all illnesses, believe me. Be connected to your friends and family members. Move beyond small talk because life has become so superficial now. So we just talk about movies and celebrities and stars. Start talking about more substantial things about yourself. Share what you like, share what you don't like, what are your most deepest concerns, your your relationships, and there are so many things that you can share about each other. So you have to go deeper than just the superficial level. And everything, sorry, there is something wrong here. Everything need not be fixed. It's not need be fixed, it is need not be fixed. All right. So it is not on yourself to fix everything. So remember this, कि हर चीज को फिक्स किया नहीं जा सकता, कुछ चीजों को जाने देना चाहिए. Just let it go. All right. So letting go really helps a lot. Adopt healthy habits because it is very easy to slip into bad habits. Whatever bad habits you developed in COVID period, let it remain there only, and try and adopting healthy habits now. Now that we can go out, move freely, be grateful for that. Actually, we were, in COVID, we were feeling that, अरे बाहर नहीं जा सकते, कुछ कर नहीं सकते. Now you have the choice. Please exercise that choice. Okay, so get moving, start exercising. It is very, very critical. Avoid comfort foods because it's very easy to fall into that habit of eating comfort foods like drinking soft drinks and eating cheesy food or sugary foods and all that. So these are comfort foods, so avoid that. So I'll just summarize today's session. Depression can happen to anyone, male, female, adolescents, children. If it is identified in early stages, it can be reversed and managed. And please do not hesitate to seek help. Seeking help is a sign of strength, not weakness. So it is better to combine medications with therapy if required. So thank you very much, Hare Krishna. If anybody has any questions, any queries, please feel free to ask. One minute. Somebody wanted to see the previous slide. Okay. I will call out the names. Hare Krishna Mataji, what if we feel sad, lack of interest all of a sudden without having any of the others? See, as I told you, if it is consistent for a long period of time, it is continuing for a long period of time, then you need to seek help. Because it may have happened suddenly, but if it is there for a long period of time, then you need to a change of focus slide. I'll show the slide later. All right. Okay. Santa Vigra Prabhu, you want to ask any question? You raised your hand.
I apologize, Mataji. I forget to lower it from the
Okay,
previous
sorry.
slides. I
Okay,
apologize.
okay. Pranali?
Hi, Krishna. Okay.
Hare Krishna.
So I was wondering what your take is on manifestation and like affirmations, you know, because like mentally you're very prepared to do something, but then coming realistically, you don't actually achieve whatever good stuff you're thinking about. So
See, the main crux of the matter is, as I told you, keep going. See, there will be time when you will be moving into, you will be relapsing into your mood swings, or you will be relapsing into your depressive mood or low mood or whatever, not inability to practice what you actually want to do. But don't let that down, let that make you feel down. You have to keep going on, you have to push yourself, and then you will reach a stage where you will start moving actually. It's like initially it will be like a boat anchored in a place trying to move, but then it is up to you to remove that anchor, right? If you are going to row a boat which is anchored, obviously the boat is not going to move, so it is up to you to remove the anchor and then row the boat. All right. I hope I've answered your question, Pranali. Vaibhav?
Hare Krishna, Mataji. Dandavat Pranam. It was a
Dandavad.
wonderful session, Mataji.
Thank
Actually,
you.
Mataji, I'm also pursuing clinical psychology
Okay.
masters right
Great.
now. I'm last year. So I have recently seen one case. So there is one lady who was suffering from postpartum depression after giving birth from child. So उन्हें एक ट्रीटमेंट दिया गया, मतलब she went to psychiatrist. तो उन्होंने उनको डिप्रेशन हो रहा था एंड शी वाज उनको फियर वगैरह बहुत हो रहा था. तो उनमें उनका ट्रीटमेंट हुआ, उनको मेडिसिन दिया गया. तो उसके बाद फिर शी वाज लाइक नॉर्मल एंड शी वेंट टू जॉब एंड शी वाज डूइंग नॉर्मल रूटीन. फिर आफ्टर 3 months उन्हें वापस वो एक डर सा लगने लगा एंड उनका इंक्रीमेंट हो गया. वो जिस जॉब पे थे उनको इंक्रीमेंट हुआ. तो शी वाज लाइक वो पहले जो पोस्ट पे थे उन्हें शी सपोर्ट, उनको सपोर्ट लगता था. तो वो एक सपोर्ट लेके ही वो हर काम करते थे. एंड अभी जो इंक्रीमेंट हुआ है इस पे उनको कोई सपोर्ट नहीं मिल रहा. एंड शी वाज लाइक कि मुझे ये नहीं जमेगा, नहीं जमेगा. तो शी वाज लाइक कंप्लीटली डर लग रहा उनको कि खाने पीने में, उठने बैठने में, हर एक इसमें. So is that because of that same symptom of postpartum depression, और उनका treatment complete नहीं हुआ, या this is another thing?
Nay, see, for anything, if she has been through a treatment for postpartum, then she needs to go in for proper assessment now, because this is something new, right? This is a fear that has set in. It could be a part of the depression which has led to the anxiety cycle. Okay. But you're also saying that she is a dependent personality. She requires help, right? She requires a support system in place. So इसके लिए जरूरी है कि वो एक साइकोलॉजिकल असेसमेंट कर ले आगे जाने के, बिकॉज एटलीस्ट क्लैरिटी हो जाए कि कौन सी डायरेक्शन में जाना है उनको. ऑल राइट, ठीक है.
माताजी लाइक उनका ट्रीटमेंट होने के बाद, मतलब जस्ट साइकेट्रिस्ट ने उनको बोला था कि आप और एक बार आ जाइए मेडिसिन के बाद. तो उनको बेटर फील होने लगा तो वो गए नहीं. तो मे बी इज दैट कि वो ट्रीटमेंट कंप्लीट नहीं हुआ, उसके वजह से भी हो सकता है.
Possible है. She will have to revisit. She will have to go back to the psychiatrist and revisit the case.
Okay.
Yeah.
Thank you,
Okay.
Mataji.
Yeah. Thank you. Okay. I will take some questions which have come on the chat also now. Okay. 1 minute. I'll start with. Can you please show the slide? Okay. This is different. 1 minute. Okay. I was abused. Then devotees helped. I came out of that. During that time, I lost almost all friends. I still feel anxious and lonely. I feel to talk to somebody, but there is no one who can give me time whenever I need. Okay, fine. So what you can do is probably whoever who has written this can probably get in touch with me. My number will be shared. Okay, after this session is over, you can probably get in touch with me and we can take this up. Okay. Another person had asked how to be focused in study, how to follow our daily routine. Okay, now these are actually study skills and following daily routine. As I told you earlier, also the only motto should be, lage raho, continue focusing on the activity that, you may be setting the daily routine every day, but you may be failing to follow it. जैसे आपने probably 7 दिन में से you followed it for 3 days. So try to, next week you can probably increase it from 3 days to 4 days. How to be focused on study? You will have to work on your study skills. That's a separate thing. You can probably call me for that. All right, because that will require some discussion on what you're doing and all, how we can take this further. All right. Can OCD be treated and where can those personality tests be done? Are there any methods to treat some particular personality traits? Yes. The personality trait tests are done by me only. I do that. So you can contact me, and OCD is treatable. If treatable means I can say, see, most of these mental illnesses, mental health illnesses are actually treatable, manageable. Okay, they cannot be cured, they can be treated, so they definitely can be treated. So no need to be worried about that. The assessment, psychometric assessments are done by me, so you can contact me personally. How to set boundaries without hurting people or even ourselves. Now boundary setting is something which is very, very important for all of us, because see, you have to be very clear that which is the boundary which is helpful for me. All right, up to what level I can manage this particular I would say illness or abuse that we're talking about. All right, and 1 minute, I lost the chat. Where is the chat? Okay, so I'm sorry, I'm a little bad at so setting boundaries is so important for all of us that whenever we do this, we have to remember one thing is that for boundary setting, assertive communication is very essential. All right. So you have to learn the art of assertively communicating what your needs are, what your, uh, you know, expectations are from the other person. And if it is not fulfilled, then you have to have minimal expectations. When you know over a period of time that this person cannot deliver what you're expecting, so you have to then, limit your expectations from that person, because you get hurt when you expect too much from a person who can't deliver beyond a certain, beyond the capacity, right? So that is something which you have to set for yourself. You have to understand the other person's limitations and accordingly set your boundaries. So those who have individual problems, I will address it. My contact numbers will be shared. You can contact me personally. Okay, I'll show the slide of challenging negative. What I can do is probably I can send it to, it can be shown the cycle of depression slide, the cycle of acceptance, and the cycle of challenging negative thoughts can be shared with everybody. You can probably go through it. If you don't understand something, you can always call me and take help. All right. I don't want to do anything life. Is it a problem? I'm well educated, but still at the same post salary since many years due to above mentality, maybe. It could be a personality issue. You need to get in touch for professional help. All right. Because this is an individual problem. How to live with people, elders who are more into thankless, always anger, stubborn, no goal in life. Okay, this is a family issue. I understand that there are elders. See something, there are some things which factors which are beyond our control. All right. So when we are living in a joint family, you have to understand one thing that there are certain people who are always going to be the way they are. So either you learn to live with them or you learn to live without them. So if it is possible to live without them, well and good. But if you have to live with them, you have to learn to find a way to live around them. So that is very important, because there will always be people who are going to be thankless. There will always be people who are angry and stubborn or goalless in life. How are you going to, work around that is up to how you are, how you going to deal with these people. Because there are certain, these are people who are not under your control. No? These are factors which are beyond your control. So there are certain things in your life which will always be beyond your control. So what you need to do is that, what is in my control? Myself, my emotions, my feelings. How can I control that? How can I manage that is what you need to work on. And probably you can take the help of somebody within the family to do some intervention, or you can also talk to your husband about it if you are married, right? But if it is your own parents, then unfortunately you cannot choose your parents. You have to learn to live with them. All right. So what else? Okay, there is YouTube addiction. Many times we go into planning mode. It doesn't happen accordingly. It gives pressure. How to handle? Yes. So what happens is, why it does not happen is what you need to understand. You may plan a lot of things, but is your planning realistic? That is very important for you to understand. Like the last part which we did about the, challenge, negative thought challenging part, challenging the negative thought, sorry. So you have to understand that why is it not happening? Probably the goals that you're setting or the plans that you have made are not realistic. So please set realistic goals so that it is easier for you to achieve those goals. All right. So YouTube addiction is something which many people have. I can't stop watching YouTube videos, even though many important work to do every day. So this is a clear-cut case of addiction. You need to seek professional help, or you have to consciously work on reducing, the YouTube consumption. Probably if you're watching for, say, in 24 hours, out of 24 hours, you're watching 10 hours, and you have to gradually bring it down to 9, then 8. It's like, how you cut down on smoking. Certainly something like that has to be done, but you will definitely need help here. Hare Krishna Mataji, what if we feel sad? Okay, that I've answered. Use of social media has shown an uptick in depression in teenage girls. Agreed with you. That is why we are going to be taking up certain things for children. बच्चों के लिए हम लोग कुछ करने वाले हैं in this particular in the next couple of months. So why am I anxious every time, even if it is a normal circumstance? So depending on what the circumstance is, आपके लिए शायद ये नॉर्मल होगा, लेकिन बाकी लोगों के लिए नॉर्मल नहीं होगा. तो ये circumstance है. So can you please talk to me? It will be better, because I need to understand what the circumstances. All right. So we will be sharing the number. Yeah, email and phone number. You can write to me also on email, and you can also send me a WhatsApp message. What is the difference between schizophrenia and depression? Now, depression could be a part of schizophrenia. All right. Schizophrenia is a larger problem. It is a mood behavior. It is a behavior where there is social isolation. Mood is low most of the times. Okay. So please do not. So depression could be a part of schizophrenia, but it is not schizophrenia. All right. So we have to look at schizophrenia and depression as two different issues. How do we deal with hallucinations? Okay, we can't deal with hallucinations, because if you're having hallucinations, then you need to see a professional, because it's not normal. All right. Because having hallucinations is not a normal behavior. How to get rid of past miseries and mental abuse by own people? This is something which will require a lot of work, Mataji, because it's not something which will go just by me giving you a few thoughts over here. You will have to work on it with a therapist. You will have to, we will have to get into the deeper this of why, how long has this abuse been happening, and how deep your abuse has been, what kind of miseries have you been suffering. So all these things will have to be taken into consideration for, you know, for you to work on your abuse and misery. Ma'am, would appreciate if you could throw some light on my question on a couple's infidelity issue. See, I don't know what exactly is the question is. I would like you to ask. Can you ask a very specific question? Is it Anika Bhasin, right? Can you please write to me personally so that I understand what actually you want to ask?
Yeah, sure.
Yeah, thank you.
I've just written on the chat to everyone. Actually, I typed it. The woman is suffering from depression, and
Okay.
she came to know about the infidelity issue of her husband
Okay.
5-6 years back, and she can't still move on. She can't like she's gone through the process of depression, and now she can't. She's able to stabilize her mood with therapy, but she can't just accept it and let go because these thoughts keep haunting her all
Yeah,
the time.
there is residual resentment, there's something we known as, yeah. So there is there she will have to take therapy for that resentment also. It's not something which goes in 6 months, right? 6 months is what you told me, right? Or 6 years? I'm sorry. Haribol? So she will have to undergo therapy for even this resentment and work on herself for that. Yeah.
Yes,
Because
she's
it's
been
not going.
undergoing.
Yeah.
Sorry. Hariom, she is going through therapy for the past 6 months now, but the
Okay.
incident happened 5-6 years back. The
Oh,
incident
okay.
happened 5-6 years back. Yeah.
Okay, so if she had taken immediate help, it would have helped, because what has happened now over a period of time, it has now developed into a very strong bitterness,
Yes.
and there's a lot of resentment for the spouse.
Yes.
So that is something which she will have to work on with her therapist.
Mm-hmm.
Otherwise, it will be very, very difficult for her to, the fact that she's sustaining in the marriage and, taking therapy or whatever. And it also depends on the behavior of the husband now. Has the behavior of the husband changed? Is he regretting what he has done? Is he working on the relationship, or is it still the same? So then if the relationship is still the same, then she's going to have a very tough time.
Yes.
So because only single person cannot work on a relationship for a long period of time. It won't sustain.
Yes.
It has to be both the partners willing to work on the relationship together, especially after something like this has happened.
Yes, sure, ma'am. Just one
Yeah.
thing I just want to add to this is that, the husband sometimes when he comes to therapy, he feels remorse and he feels guilt about putting his wife through this. But when he goes to the house and he has to reassure his wife whenever some negative thoughts come into her mind, when he's traveling supposedly, and she again starts to imagine that he is with another woman or something, then he doesn't give her that reassurance or doesn't tell her that no, I'm there for you, and you don't. He will either do a video call, like he'll just take it upon himself to prove himself right. So there's a lot of contempt in the relationship also.
So it's a personality type. So probably the therapist will have to look at what kind of a personality which this husband has, because if he has a personality which keeps swinging from, a very self-centered type, a narcissistic type, to somebody, being very remorseful, regretful. So that's again fluctuating personality. So definitely he needs to be assessed.
Sure.
That is important. Yeah. Yes.
Hare
So
Krishna, thank you so much. Thank you.
yeah, thank you. So anybody has questions? I think I'll take audio questions, because मेरे वो chat में बहुत सारे questions आ रहे हैं and individually I'm not able to answer all the questions. So if you can ask the questions, it will be really nice. I like interacting with people. Yes, Varsha.
Hare Krishna Mataji.
Hare
Like
Krishna.
suppose in real life, like suppose people undergo through various separations and divorces and breakups. So like suppose one person has had a very bad breakup, and now his psychology is that he doesn't want to get into another relationship. So how like it is become fixed in his mind that he can't get into another because he feels that again it will end in the same way and it will hurt him more.
Hmm.
So how can that person change this mindset? Like how
Okay.
can we do something about it?
Okay. So you want to change the mindset of a person who has been hurt by somebody else, right? Is that what
Like
you're
he's
right?
now he doesn't want to get into another relationship just
Right.
because that one failed and he is now very much into depression कि नहीं मुझे अब नहीं करना है because end
So,
result
so he actually, I don't know whether he has gone for help, because men normally feel they don't need help in such cases. But I have personally helped so many teenage boys overcome, such breakups and such issues of mental health, where, they have had relationship for 2 years, 3 years, फिर breakup हो गया, in some cases even of 6, 7 years also. So it is not easy to overcome something like this easily. All right, there will always be a fear of being hurt, so you have to just reassure and support this person whenever he's talking to you, or whenever he's discussing certain issues with you. So be supportive instead of pressurizing him to take a decision for a particular relationship. If you're there and support him, I think things will time will take time will heal everything. Time heals everything. It also depends on how long this happened, how long ago this happened. If it is a recent experience, definitely time needs to be given to heal. All right.
so does this person needs therapy any kind of
Yes,
or
definitely, because he is hurting, na?
uh,
He is hurting because of whatever has happened. So he definitely requires help. See, and if it was hurting, if he was just hurting, it is okay. But he is also fearful of taking another step now. Like if suppose lifelong this person decides that I don't want to get married, or I don't want to get into any relationship or any commitment. So that means he is pulling himself away from something that could be beautiful. Probably this one experience is not good, but probably the next experience may be a better one, or it will be a better one. So somebody has to talk to him to make him understand that. That is important. Yeah. So thank you, Varsha. Anyone else who has questions? Somebody has asked here a question. Mataji, can one's feelings about past neglect or miseries possibly be not real, and it is just a feeling one have because of difference in behavior that one is unable to accept due to cultural? I didn't understand this question. Uh, Bharat Rathi, Prabhuji, how to deal with procrastination? That is a session by itself. It's a huge session. Yes, tomorrow also I will take the session. Tomorrow session is on anxiety. It is
Mataji,
not. Yes.
Hare Krishna, Mataji, Dandavat
Hare
Pranam.
Krishna, Dandavat.
Mataji, this like many times, in the when we are living in the corporate world, many times the anxiety comes when people are not, they write any languages in emails and any communication. So we get frustrated, and normally what as nowadays we read emails, in the evening times, morning
Yeah.
times, and the things go for the toss. So like so how to handle such situations?
Yes, yes. I will answer your question. Yes, homeopathic medicine does help in depression, but depends on how severe the depression is. If the depression is very severe, then it might help to go in for allopathy first, and then over a period of time for maintenance, you can go in for homeopathy. All right. So answering your question that you're in the evening and you receive some mails, official mails. May I know what is your name? Who was just talking? Because I'm not able to understand.
Raghunath
Yes.
Raghunath.
Okay. Okay. So when you get such mails, yes, I understand what you're going through. Even my husband sometimes, he gets a little worked up whenever he gets he works for Bhaktivedanta Hospital also. So he also gets a little worked up and anxious. Ki, "Arey, ye mail aa gaya, abhi kya karne ka?" So, and you're in that, frame of mind that you're spending time with your family and suddenly you receive that mail. So at such times, what you could do is probably, I don't know how essential it is for you to read the mail, first of all, in the evenings once you come back home. What is the kind of work that you do, Prabhuji?
Yeah, we do like many times, on the mobile, like when we are in, kind of service or business. So we read normally messages, email,
I know that. So that's why I'm asking you that is it essential to read those messages once you're home? Or it can be avoided. Can it be avoided reading those messages? You're talking about WhatsApp, right?
No, not WhatsApp, either emails.
So emails is something which you have to access, right? अगर हमने access किया तो ही वो message हमको आएगा. It's not like, even in WhatsApp, of course, you have to access the messages. So my question to you is how essential it is for you to read those emails in the evening. Unless and until it is an emergency situation.
Sorry, Mataji, due to net.
Did you get my question, Prabhuji?
No, Mataji. Yeah, there was a break in between. I could not hear. Yeah.
Okay. What I'm saying is that how essential is it for you to actually, see that email? See, because what happens now, all this is due to our inability to set boundaries. When we come home, we have to be very clear that I will not be taking up any office work unless and until it is an emergency. Now, all the mails that we receive in the evening is not an emergency issue, right? So only when it is, so only when it is an emergency issue, you need to look at it. Because unnecessarily we look at mails and then we get, worried. What this, what about that, what about this? So it doesn't make sense. So when you're home, be at home, and when you're at office, you be in the office. Simple. You handle your emails in the office, and when you come back home, you be with your family. That is the best way to get over your anxiety. Unless and until it is emergency and it is essential, urgent and important, jab tak nahi hai, tab tak wo mail attend karne ki zarurat nahi hai. All right. And if it is something really, really urgent, they will call you.
Thank you, Mataji. Thanks.
Yeah. Okay. Yeah. Anyone else? Any questions? Hare Krishna.
I just want to know, for such issues, you said it's always better to seek help, but there is lack of knowledge, like where and how to seek help. Where should we start? Can you please guide us?
Yeah. See, it first is being able to identify. Now, at least you have understood today, what are the signs of depression. We will be tackling anxiety tomorrow. So what are the signs of depression? Now you understand that it has to be there minimum for a specific period of time. So if you or any of your loved one is suffering from something like that, so where do you stay, Prabhuji? Hare Krishna.
Yes, Mataji, I stay in Pune.
Pune. Haribol?
Yes, yes.
Okay. So there are people
Yes, Mataji,
available in Pune also. Okay. So you can contact me. I can provide you with numbers of people in Pune. So don't worry about that. All right. Reliable resources are available in Pune also.
Yes, Mataji. Thank you. I'll contact you, Mataji.
Yeah. Okay, fine. What is your one piece of advice for today's young generation and people here? on depression or sleep deprivation that you would like to say, so we can take that advice and practice it from today? Very nice question. I in my presentation, I repeatedly mentioned something known as routine. I hope, see, because routine is something which all of us seem to have lost track of. Going to sleep on time, waking up on time, everything seems to be rotating around, this. So let's not revolve our life around our mobiles. Let's revolve our life around our health. Let's take an oath or a pledge today. Okay? From today, self-care is most important for me. I am going to take care of myself irrespective of what is happening in or around me. Okay, there may be some emergency situations which will come up in our life. Definitely at that time, you have to think of others. But most of the time here, you will now start thinking about yourself, your health. Because if you are healthy, you will be able to take care of others, So the younger generation, especially today's generation, I would say they really need to work on the physical activity level, because everything is available on the, click of a button. So here, for the younger generation, it is important that physical activity and a routine, eating properly, sleeping on time, waking up on time, exercising, taking up responsibilities at home. So all these things will make you a better person also, and also a more healthier person. So all these things have to be, taken seriously, and they have to be tried. You can start implementing that from today itself. It's 9 o'clock, so 9:30, 10, you can decide from today I'll be sleeping by 10 o'clock. It's not such a difficult task if you put your mind to it. So that is my advice for the current generation, that please set a routine or have a routine in place which can be managed, which is not too heavy duty for you. Anyone else? So I'm going to be any which ways. Any questions? It is not that residual resentment everyone will have when one undergoes some bitterness in life. I didn't understand this question. Sandeep, are you there?
Hare Krishna Mataji, it
Hare
seems to be
Krishna.
like, is it not true that residual resentment everyone will have when one undergoes something?
Not necessary, na? Depends on the person. See, it depends on your personality also. If you're a person who is like, who just, kinds of flicks away things and says, "ठीक है, चलेगा, जो हो जाएगा, देखा जाएगा आगे," So if you're somebody who loves to move on in life, not looking back at things, whatever have happened, then obviously, that it will not affect you. You will be able to manage. So I'm just sharing my email ID and my purification leads to depression. Definitely not. Why would it lead to depression?
Hare Krishna Mataji.
Hare Krishna.
Mataji, I have a question that even like I have tried to make many routines, but I'm not able to follow it for a long time.
Okay.
Like, yes, ma'am, this is my problem. I have like tried many times to just make a proper routine. I really want to just focus on it and just follow it, but I'm not able to just follow this for a long time. I'm just doing it. I'm just following it for 1 or 2 days, but again, I'm on the same situation. I'm not able
Yeah,
to.
I understand. This is, see, what happens is that if you don't have, as I told you, if you're able to follow a routine, even, yeah, I can get, even diet is difficult to follow. I know it's difficult for me also, even I'm facing the problem. So, but I look at it in a larger perspective. Suppose in 1 month, so do you have a tracker on mobile? All of
Yes,
you have any health tracker? Okay, so you can see 1 month ka track. Okay, in the last 1 month, I normally do that. In last 1 month, how many days of exercises I've done, how many calories I've burnt, what kind of food, what kind of, how much water. So so first you set for the week. Let's not look at the month. Let's just set for goal for 1 week. As I told, no, set small goals. If week is also too long, set for 3 days. Okay, next 3 days, I'm going to wake up at this time, sleep at this time, do these activities and try and follow this. Even if 3 days is a problem, do it tomorrow, just one day. So start with small goals and start with goals which are realistic and achievable. Remember this always. Smart goals का वो याद रखिए आप लोग. The smart goal, S stands for specific, M stands for measurable, A stands for achievable, then R stands for realistic, and T stands for time bound. I'm not getting into the details of that. So when you're setting your goals, they have to be smart goals. Remember this. And they have to be goals which are small goals for initially for people who are having difficulty achieving, bigger things. Set smaller things, for yourself. Set things which you feel that you will achieve. All right.
Yes, ma'am. Ma'am, I have one another question, that is, ma'am, I really want to make a habit of doing meditation every day. So, ma'am, how would I start like meditating, and how to just focus, because it's very difficult to just stay focused on one thing for just 5 or 10 minutes only.
See, meditation will be a problem if you are suffering from some illness. Okay. Meditation will not come automatically. It comes through practice and it comes through a stable mind. So normally when somebody is suffering from depression or anxiety, we don't give them meditation as क्या बोलते इलाज की तरह हम लोग देते नहीं immediately. It is given after some time, so practicing mindfulness, because their tendency to go into negative thinking is very high. All right. So I don't know what problems you face when
Yes, yes, ma'am, meditate. Ma'am,
meditate.
actually, whenever I just start like meditating, and after just 2 or 3 minutes, some other like thoughts are started coming
Exactly.
in.
That's what I'm saying. People who overthink, or people who have thinking problems, overthinking problem, should not get into meditation immediately. You should first channelize your energy and then come to meditation. So before meditating, if you do some cardio exercises and you meditate, it will help you.
All right, ma'am.
All right. Yeah.
Yes, ma'am.
Acha, there is some question. I have shared my name, number, and what email ID and my WhatsApp number. Okay. Is bipolar syndrome curable? No, it is not curable, but it is treatable. As I told you, most of these illnesses are not curable, but they are treatable. Okay. They can be treated. Sometimes if it is mild and by God's grace, Krishna wishes, it will be cured. Think setting boundaries is very important for our mental health, but we don't know where to start or know any proper resources. Can you shed some light on this, Mataji? Daily chanting 16 rounds comes under meditation, Mataji. Yes, it is a part of meditation if you consider it meditation. Okay. Setting boundaries is important for our mental health, but we don't know where to start or know any proper resources. Can you shed some light on this? Will you be able to get in touch with me? I will be able to help you on this, how to set boundaries, because I am, it is by itself a topic for discussion, how to set boundaries. I cannot give you a crisp or a short note for this, summarize nahi kar sakte ho. But what you said is important, that definitely setting boundaries is important, very, very important for a mental health. But we don't know where to start. You can start by, as I told you, you can set small goals, Mataji. Instead of, having larger things, at least start by, okay, that from tomorrow onwards, I will have some me time. The first thing in boundary setting is me time. Take time out for yourself. So that is the first way that you're going to take care of yourself. So once you are able to do that, okay, दिन में 1 घंटा मैं अपने लिए निकालूंगी. That is for probably my exercise, my meditation, or taking a nice warm bath, or whatever it may be, or talking to a family, talking to a friend. It could be anything. but that is my me time. It is only for myself. So start with that. It is just one step. If not half, if not 1 hour, then at least half an hour. Okay. So you can start with that and then you can take other steps. All right. If you have any problems, you have my number. You can always get in touch with me. So
Yes,
any,
Mataji. Sure, Mataji. Thank you, Mataji.
thank you. Any questions? Any comments? Any suggestions? Because we are having, after knowing how to behave for particular hurting from others, we behave as we realize outside, but inside feels still existing, which can be felt in starting days. How to overcome this, ma'am? Okay. How to behave for particular hurting of others. Okay. We behave as we realize outside, but inside. Yes. Yes. Okay. I got it. So you have been hurt by somebody and you are just superficially behaving as if you're okay. Correct me if I'm wrong. Yeah, no, sample test cannot be done at home. You will have to go to a professional. But for what you want to test yourself, Mr. Nirav, what do you want to test yourself on? Okay. Anyways, second. So answering the question about superficially, because you're trying to pretend that you're not hurt. So the first step in, uh, the hurt part is that accepting that you're hurt. Second is expressing that you're hurt. And third is working on that hurt. So working on that hurt, initially you need not pretend to be okay with everything around you, right? You have to express, you have to show to the other person that you're hurt by his or her actions. So you are allowed to behave in a specific manner as long as, you are not hurting other people around you. So you can close yourself down, you can shut down for a few days, you can isolate yourself and think about it, introspect, and also after that you can do the expression of your hurt. Here you are trying to pretend that you are not hurt, that is why it is hurting you more. So you don't need to pretend. Yes, you're acting like ignoring their hurt. You don't need to ignore, you have to express. If you're hurt, and especially by a closed one, then you have to tell that person that I'm hurt because of your behavior. All right. And then you wait for that other person to respond. There's no harm in telling that you're feeling hurt. So any questions? Anyone else? Or should we wind up for the day? It's 9:10 now. How to live with people who are depressed, and me myself have identified and accepted my issues. Yes, as I told you, self-help, and also when you are a caretaker, there is something known as the caretaker syndrome. What we normally do is that over a period of time we start feeling that, this person cannot survive without me. No, it's not like that. Everybody in this world is going to you are not indispensable. There are people who are going to live and survive without you also. So you have to set your boundaries very, 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 very clearly as a caretaker, that this is how much that I am going to extend myself. Beyond this, I am not going to do. So that boundary you have to set for yourself, because that is not something which I or anybody else can do for you, but you have to do it for yourself. How to live with people who are depressed and take care of yourself. That is most important, because unless and until you take care of yourself, you will not be able to take care of others. So there is a saying, na, Jivana sarthaka kari kari paropkar. First you look at yourself, and then, first you take care of yourself, and then only you'll be able to help others, extend yourself. After all expression, still if it continues, then we try fix ourselves. Yes, definitely. Inside pain, I must overcome. See, don't have this must and should in your life. That is one demand which which you should not put on yourself. That I must overcome this, I must overcome that, I must do this, I must do that. So all these shoulds and must will make you all the more, miserable. Try to do certain things which will help you overcome that particular fact. If you are not able to overcome, you can seek help. No? There is always people who will be able to help you. Vitamin D has an impact on your overall health. Okay, there have been times when a reduction in vitamin D has caused, in some people depression or even anxiety. So getting it checked is good. It is always better to have your your vitals in place. That is important. All your vitals stable and in place. So okay, I think we are done with the questions. I hope I have answered all the questions. Is there anybody whom I have not answered? So thank you very much. Hare Krishna. I hope to meet all of you again tomorrow. And we will go on our journey of move on our journey of mental health. And we will be tackling anxiety tomorrow. So today we learned about how to overcome depression. Tomorrow we will be working on anxiety. So thank you very much. Hare Krishna. Good night to all of you. Yes, Piyush, you have a question?
Yes, yeah, as you said, Hare Krishna, the thing is, I got anxiety. So just wanted to ask you that, as you said, can it be cured?
Anxiety? Yeah, if it is mild, it can be.
Okay.
If it is mild, it can be, yeah. It can be. See, I would not say 100%, 99% cure ho sakta hai, but there are chances that it will relapse. Over a period of, if you don't learn to work on your skills of, working on your anxiety, it will come back.
Oh.
All right.
So it is as good as managed and what we say treated, but cannot be cured. Correct?
Cured, हाँ, मैं cure का बात नहीं करूँगी अभी, because anxiety and all, I have seen it coming back after, even many years it comes back, If it is not treated properly, it comes back. But there are people who have worked on, if it is at a mild, moderate level, they have worked on themselves and, they have done beautifully in life. So I have seen some cases which don't come back also. They are doing very well now. They are my clients and doing very well in life. So that's not a problem.
Thank you so much.
Yeah, thank you. So Hare Krishna. Good night to all of you. See you all tomorrow. Yeah, Hari Bol.
Hare Krishna. Thank you very much. Hare.
Thank you.
Thank you, Mataji. Hare Krishna.
Hare Krishna. That's all.